My name's Sunil Patel. I'm a consultant physician in respiratory and intensive care medicine based in London. It's a good question. I think I've always had an interest in working out how things work and when they don't work and what that means for patients. But particularly, I had an interest in respiratory medicine as I found that the complaints and symptoms that patients have are quite common in terms of cough and shortness of breath. And I always found that the diagnostics involved in these symptoms are quite interesting. And I'm quite a practical person. I like performing procedures in the specialty, and medicine seem to offer a nice mix of both of those things. It also is a specialty and discipline that interacts closely with patients, of course, and I do value the patient interaction, and very few occupations can boast that. I think respiratory medicine works very closely with a lot of other specialties. A lot of the conditions, chronic conditions particularly, overlap with other specialty areas such as cardiology and rheumatology. So you work closely with other teams with a common goal to diagnose patients with complex conditions. I also like the fact that it covers a range of acute problems, acute symptoms, as well as long-term conditions as well. And it's very practical specialty with lots of time in performing procedures to help aid diagnosis. Again, I think respiratory medicine has a nice mix of outpatient exposure to patients as well as inpatient care, and as well as acute care of patients with respiratory problems. So I find that I'm able to help people in times when they're acutely unwell, as well as provide them long-term care and see how their conditions are improving over time. And I find that particularly rewarding in this specialty. I think I can offer patients time to be heard. I try and allow enough time in consultations for them to give their story and symptoms so that we can reach a common goal. I do particularly find that patients want to be involved in their care and help direct their care. So I always offer them the opportunity to contact me in between appointments to see if there's anything else they want to share with me, which may be useful. And I do also keep in touch with them informally in between the appointments to see how things are going with their care and to see if treatments have worked.